So my name's Kianna Carter, and I'm a clinical social worker, and I'm one of the youth engagement services clinicians, and we're attached to Marybridge Children's Hospital. And so I'm just here to go over our two programs that are rooted in Tacoma Public School District and Sumner Bonnie Lake School District at this time. So essentially, the YES program is a cross-system collaborative treatment model for youth, specifically in Pierce County. Now I'm ready for the next slide. So just to provide some background, so in 2020, the Office of Superintendent, or OSPI, allocated about $8 million in federal elementary and secondary school emergency funds under what was called the CARES Act grant. And that is how YES initially piloted. We definitely saw a need within Tacoma Public School District specifically, since Marybridge is in Tacoma, and just saw a lot of youth struggling coming into our emergency department, higher acuity for their behavioral health presentations, and really just saw an opportunity to fill some gaps. So essentially, the Youth Engagement Services Program is a collaborative partnership between Marybridge Children's Hospital, as of now, Tacoma Public School District, and Sumner Bonnie Lake, and Kids Mental Health Pierce County. So we're all kind of intermingled with one another. And really the overall objective of our program is to provide behavioral health support services to Tacoma Public School District and Sumner Bonnie Lake families and students when kiddos are at risk of harm to self, others, if there are concerns for incarceration, perhaps the kiddo's been to an ER for behavioral health or psychiatric related complaints. We oftentimes service kiddos in the foster care system. All of these different kind of components tie into that underlying behavioral or mental health concerns or complaints. So within the YES program, we follow a three-tiered approach, really to help assess and identify kiddos who are at risk of interrupted learning due to some type of behavioral health risk factor. And so really what we do is try and break our tiers into three different models. So we have tier one, which is behavioral health navigation. Tier two is where that Kids Mental Health Pierce County comes into play, where we do some multidisciplinary team consultations. And then tier three is that really kind of specific direct practice where we offer brief therapeutic intervention services. So we'll dive into each of the tiers just to kind of give an understanding of what each of these tiers, kind of support the kiddos. So within that tier one model, it's essentially behavioral health navigation. And so the idea is to be able to support students and their families, when applicable, with identifying, coordinating, and providing support and accessing behavioral health services. Kind of some background around why this tier was really created was primarily because we recognize that our behavioral health system oftentimes is incredibly challenging to navigate. And so we noticed that our behavioral health system is navigating silos and really trying to support and walk alongside these youth, their families, caregivers, whatever the case may be, or whatever their support system looks like to help navigate with accessing appropriate behavioral health services. So within this service level, a screening assessment occurs, and that's done by a YES clinician, and a determination is made regarding the specific tier assignment. So sometimes kids can be assigned to tier one, where that's more of a lower level and we're helping connect them to behavioral health services, or we're looking at other multidisciplinary team staffing opportunities if the appropriate resources can't necessarily be found within that brief behavioral health navigation.
Kianna, can I ask a quick question?
Of course.
For finding resources, you're working within the school setting, like with these kids, that's how they're getting identified, and that's who, one of your partners is.
Right.
When you're finding them resources, is it any type of resource, including like community outpatient? Can you say a little more about like what types of community resources you like help identify?
Absolutely, yeah. So it would be specific to behavioral health. So I know some examples might be just your run-of-the-mill outpatient behavioral health individual counseling. So I know that in certain instances, we've supported with connecting kiddos to MCO case managers to identify like ABA providers. So the resources are very specific to behavioral health and really trying to support
Okay, but they're not school-based, they're community-based.
They're community-based, yes.
Okay,
I
great.
think the hiccup is that our referral entry point typically is going to come from the school.
Okay, great. Thank you for clarifying.
Absolutely. Okay, and just an overview for those that are not familiar with the community multidisciplinary team meeting within Kids Mental Health Pierce County. Really, the overall goal is to have it be incredibly community collaborative, family-centered. So oftentimes folks who are attending these meetings can be natural supports of the youth. It can be payers or managed care organizations and their case managers. It could be a behavioral health provider. We try and link in the school system since we are so intimately tied with them. It could be different like ABA specialists, different service providers that the kiddo's interfacing with, and other community system partners. So we oftentimes see DDA workers, juvenile justice systems, DCYF. So really trying to bring all the relevant community partners around the table to be able to do some consultation regarding how we can meet the behavioral health needs of the youth. So that's kind of an overview of that roundtable multidisciplinary team meeting that we partner with Kids Mental Health Pierce County to support our students with. And just to drill down on the MDT component. So essentially the tasks that we really trying to accomplish within MDTs can vary depending upon the youth and the case and what's happening. But some general things that we see typically come into play are outpatient service recommendations, support with care coordination, behavior management strategies. It could look like complex safety planning if a kiddo's discharging from an inpatient psychiatric unit. It could be transitional planning, discharge planning, and just in general family engagement strategies to really be able to wrap around the youth in their complex behavioral health presentation to really support stabilization within the community. And then our tier 3, so that's going to be our brief therapeutic intervention. And so that is where that direct service practice comes into play. So the criteria for tier 3, really we're looking at students with the greatest needs to be referred to a yes clinician. And the idea is that we work with kiddos for up to 90 days with the overall objective of developing a treatment plan in collaboration with the students, families, or any relevant supports around the kiddo to help provide the youth the necessary resources and supports to maintain safety within their school and then the larger community. So essentially the yes clinician conducts a student and or family assessment depending upon if the kiddo's seeking services confidentially or if there's some caregiver involvement requesting that referral. And the idea is that we're trying to be collaborative and create a treatment plan aimed at stabilizing their mental health symptoms that might be contributing to the disruption in education and other functionings that is obviously behavioral health related. The yes clinician will provide brief therapeutic intervention, which can look really different depending upon the treatment modality and what the main goals are. So sometimes we see clinicians doing one-on-one counseling, meeting with kiddos at the schools. Our clinicians can go into homes as well. That can look like family therapy and sessions, crisis planning, safety planning. And then after all of that is coming to an end, prior to closing the case at the end of those 90 days, the yes clinician works with the student and or family to develop a transitional plan, really to ensure that the kiddo is getting that continuity of care, and if it's warranted, connecting them to ongoing outpatient behavioral health resources to continue their care. And so what everybody really wants to know is the eligibility and referral process. So as of now, our program is specifically working with students in the Tacoma Public School District and Sumner Bonnie Lake School District, ages 13 and up. And most of our referrals typically are coming from school counselors, teachers, school social workers. We've had some come from like special education teachers as well, para-educators. It really is kind of the run of the gamut in terms of school personnel. But in all honesty, if you have a kiddo that is meeting criteria for this, we've also had referrals come from caregivers as well. We've had a few come from hospital social workers. at Mary Bridge. So if you feel like you're working with a kiddo who is in either of these districts and meets that initial age criteria, we're more than happy to have a conversation and do some consultation around if we can generate a referral and if the kiddo would be a good fit. And then in terms of the referral portal, so all of the YES programs, so Tacoma Public School District and Sumner Bonnie Lake, our two referral portals are going to be accessed on Kids Mental Health Pierce County under the YES program, and each one has their own referral portal. And it's very basic demographic information. We just want kiddo's name, caregiver information as needed, and then just a brief overview of why the referral is being generated. And in terms of complex behavioral health presentations within the context of this program, we've defined it as youth with high-risk behaviors or risk factors such as self-harm. Perhaps there's multi-system involvement that could look like a kiddo maybe is in STD treatment, is connected to DDA, maybe they're in the foster care system, maybe there's some juvenile justice system involvement. The youth can also be referred if they've been identified as a high utilizer of the crisis mental health system. And really we're looking at like emergency department visits, crisis encounters, perhaps psychiatric inpatient hospitalizations, and really any other complex psychosocial presentation that would benefit from brief therapeutic intervention or perhaps a multidisciplinary team staffing or support with behavioral health navigation. And then this is not in my slide, and this is probably like the most important part. So because both of our programs are contracted through the school district, we're able to work with kiddos regardless of their insurance coverage, which is a really kind of nice middle ground to be in. So we oftentimes will get lots of referrals from kiddos with, sorry, my work cell is ringing, great. We typically will get referrals for kiddos with private insurance coverage. And so we are able to work with them and support in that regard. So insurance is not a barrier for accessing our services. So in terms of just the referral process and reviewing those referrals, so students can be referred to YES via the Kids Mental Health Pierce County portal. And I have linked that as well, and we'll make sure that the slide deck gets sent out to everybody, and I'll also link our portal in the chat. Typically our referrals are reviewed 5 days a week by myself or Ashley Mangum, who's the program coordinator. And we try and respond within 2 business days. And what that response typically looks like is letting you know that 1, we've received the referral, and 2, it's been assigned to a clinician, and you'll know at that time what clinician has been assigned. And typically it's about a 72-hour turnaround for the clinician to be able to do outreach and start that assessment process as of now and how our volumes look. And I think that's about all. I also linked my contact information and Ashley Mangum's as well. Like I said, if you guys have any questions about a kiddo or need like case consultation, maybe you're kind of on the cusp regarding like whether or not a kid would be a good fit for our program, we get inquiries all the time, and we're happy to have a consultation and have a conversation and go over the program to see if it's a good fit for you.
All right, thank you, Kianna. How about questions? Anybody have things they want to ask about her, about the program or the information she shared? I guess I'll ask a question. So you mentioned, so you guys are contracted or partnered with the school district, and so that is covering kind of the cost of the service if you're engaged in the brief intervention. But you mentioned something there about insurance. So so you're saying it's not a barrier. They're not going to look at what kind of insurance you have and determine you can't get the service based on a certain type of insurance. Is there ever a time where you would utilize insurance instead of having it covered by the district, like post 90 days, or where you're going to use the insurance to help them when they do connect with like a discharge plan or other providers?
Yeah, that is a great question. So I guess I should clarify, the entry point into our program is not contingent upon insurance coverage. So all kiddos can be referred regardless of their insurance coverage. It does get a little bit challenging in terms of like behavioral health navigation sometimes. So in that regard, yes, like we'll always ask like, what is their insurance coverage? Not because we're billing it, but because that guides what we can support with helping the youth and their families access with their insurance coverage. So yes, yeah, we do have to play around with the insurance, but an initial referral into our program is not contingent upon somebody's insurance coverage.
Okay, so it sounds like the primary qualifiers are that they're 13 or older and that they're within one of these school districts, Tacoma, Sumner, Bonnie Lake, and that they have a kind of high level behavioral health need.
Obviously.
Anybody else?
I see a hand.
Hi,
Okay.
yeah, Betsy has her hand up.
Okay.
Yeah, hi, this is Betsy. Let's see. You know what? Could we drop the slide deck so we can see each other again? I just see the slide thingy. Thanks.
And just a reminder, Betsy, some people may want to be off screen for the recording.
Sure.
That's an option. Okay, thank you.
Sure. Okay, so Kianna, I have two questions. One of them is if there might be plans to expand into other school districts in Pierce County. I'm assuming you're like limited to Pierce County because of this grant, but I'm thinking about like Clover Park, for instance, or Bethel. And then my other question is if you could kind of talk through what might happen in a yes referral for a kid specifically with autism that's having behavior struggles, as opposed to like a typically developing kiddo that has clear on mental health issues.
Okay, so the first question, just so that I'm understanding you correctly, are you wondering if other kiddos outside of those two districts can be referred into our program?
Well, I didn't think that, but no, I was thinking more, so, you know, it feels like it's fairly new and maybe those are the two school districts that have been identified as the greatest need right now. And that maybe there could be plans to expand it further. Yeah. That's, yes. But yes, since you said, yeah, you know, if
yes. That's a good segue. So that's still in the works a little bit. So I didn't want to like air anything out like too specifically because the details are still there, kind of being fanned out. But so we are in the works of standing up a Yes Pierce County program. And so essentially it would be different from our two district programs in the sense that right now our referral entry points are primarily school district like generated. Our Yes Pierce County, the entry point for referrals would come from all multi-care ERs in Pierce County. So it would really kind of widen that encatchment and would be a larger yes team, but we're still in the process of propping that up. So to come, yes, to be determined, but yes, yeah, we're trying to widen the encatchment.
Great, that's awesome.
And then to speak to your second point, so in terms of like a yes referral for a kiddo who perhaps is on the spectrum, might be having like some behavioral concerns and a yes referral is generated, typically, and not always, and it's so interesting, I just staffed a case with a clinician yesterday with almost this like exact presentation, so it's very fresh, but essentially, in those events, more times than not, we'll generate a multidisciplinary team meeting. And really the idea behind that is that like our brief therapeutic interventions, we recognize is not always like a fit for every behavioral health presentation. But that certainly doesn't mean that there can't be support founded within our program. So typically an MDT is going to be generated. And then again, like the different like support systems.
Can you say what that stands for again, just for people who came late?
Yes, yeah, a multidisciplinary team meeting. And so that's through Kids Mental Health Pierce County. And so essentially what we would do in that scenario is really try to identify the key players that are centered around this kiddo. So this could be school personnel, maybe this is folks like within like their special education program and different service providers that are working with this kiddo to be able to do a staffing and really get more into depth regarding what's happening to try and generate some referrals and recommendations. So typically with the yes referral like that, the kiddo is going to access an MDT and then support with behavioral health navigation. So pending that multidisciplinary team meeting, that guest clinician can support with those recommendations that were made during the meeting.
Okay, thank you.
Yeah.
So to follow up on Betsy's question there, I could imagine, not always, but sometimes when you get a referral for a child who's on the spectrum, they may have members of their treatment team like an ABA provider. And so when you get a service request or a staffing request for a kid who already has services, and you might recommend a brief therapeutic intervention, how do you partner with their existing providers, whether they have a behavioral health provider or whether they have an ABA provider? What does that look like?
Yeah, that's a great question. I mean, just best practice, I think anytime that we are interfacing with a youth who already has established service providers, we try and get those release of information as quickly as possible to be able to partner and have a conversation regarding what work are you doing, what are the treatment goals, and how can we collaborate as a team to wrap around this kiddo to try and meet their needs in a way that makes sense. So we partner very closely with any of the service providers that are interfacing with the kiddo before we received the referral.
Kianna, I heard you say that or way back that if ABA is an issue, that you'll be contacting the like a behavior support person or a case manager at one of the MCOs to do that work of identifying if the kiddo doesn't have ABA therapy to help them find somebody and get it going. Do all of the MCOs have these case managers? I know Molina has a pretty robust program, and I think CHPW does, but I'm never clear on like United Healthcare or
Like
America, for instance. Yeah.
So I know coordinated care, like there have been some instances where I'm able to work with like a behavioral health liaison, but absolutely, you're correct. I think Molina and CHPW do a really nice job at being able to access those services and being able to partner with them in the events. So AmeriGroup is kind of hit or miss. That's been my experience with accessing them to support with ABA services. And in those events, I typically will generate, again, like a multidisciplinary team meeting just to see if there are any recommendations outside of the MCO. So typically the MCO is like our first stop to see like what's available, and then we'll continue to escalate it up if we can't find the answers or the resources that we're looking for.
Okay, thanks.
Any other questions?
I think it's been a great presentation, Kianna, and you've answered a lot of gaps for me with it.
Yeah, very, you hit all the most salient things to make clear kind of what you're doing and how to access it. So thank you very much for coming.
Absolutely.
Yeah.